My name is John Paptianari, and I'm in the honoured position of being the Benalla Health Board Chair. It's my pleasure to introduce Nikki James, a proud Yorta Yorta Moira clanswoman, to conduct the Welcome to Country for our annual general meeting.
Good afternoon, John, and to Jackie, the CEO, and all Benalla Health AGM members. My name is Nikki James. I am a proud Yorta Yorta Moira clanswoman. I'm also a cultural officer and a businessman. I would like to acknowledge traditional owners of the land that you annual meeting on today, the Yorta Yorta Nation. I pay my respects to my ancestors, my elders, past and present, and any other Aboriginal person present. The Yorta Yorta people make up of 16 family groups and 8 clans. Moira, family, Felicity, Prosper, Yamana Yona, and Uraila. I'd also like to acknowledge the stolen generation, those who have passed, those who have come home, and those who are still looking for their families. As we walk in the footsteps of my ancestors, the First Nations people, I welcome you to land and country, and thank you for allowing me to talk today for your annual
General meeting. Yes.
General meeting. Thank you.
Thank you, Nikki. I would also like to acknowledge the traditional owners and custodians of the land on which we meet today, the 8 clans of the Yorta Yorta Nation. I also pay my respects to their elders past and present and thank them for their contribution to our health service. It is a privilege to be standing on Yorta Yorta country for the Benalla Health 68th Annual General Meeting. I can confirm that we have a number of attendees online, including the Benalla Health Board of Directors. You will have noted that this annual general meeting is being held later than usual. The delay caused by the state election late last year and the deferral of the tabling of our annual report in Parliament. That was tabled 2 weeks ago, and we expect for our next annual general meeting that it will be held later on in this calendar year. Our 2021-22 annual report is accessible within the corporate documents section on the website. You will also have the ability to ask any questions through the online chat function during this meeting. There are 2 open agenda items, 2 open actions on the agenda. The first one is I would like to call for the minutes of last year's annual general meeting to be accepted. So thank you, Dennis O'Brien, for moving that action. I will second the action as a director attending at last year's AGM. The second action is I would like the directors to declare any interest. Thank you. I have a confirmation that there are no declaration of interest from the Board of Directors. The Benalla Health strategic plan that we worked towards was predominantly developed in 2019, that is pre-COVID-19. And our expectation is that we will initiate the process for development of our next strategic plan later on this year. And we hope to share some of those insights at our next AGM. This process will be initiated with extensive community consultation. Additional to the structural changes brought on by the pandemic, we recognise the evolving composition and needs of our community and the changing nature of workforce, financial and technology adoption challenges that do compel us to plan for a different future. Having said that, over the past financial year, Benalla Health has worked diligently in evolving our activities against the priorities which remain very relevant to us, and there's a number of achievements that I'd like to summarise. Firstly, in terms of delivering responsive, high-quality services, pleased with the increased number of babies born at Benalla Health, our focus on our surgical eye procedures, the evolution of our urgent care centre and the number of presentations at the centre, and also the extent of our perioperative services. It's well publicised that the health sector and many other industries have faced unprecedented challenges on the workforce. I'm pleased to report that despite these challenges, we have maintained approximately constant staffing levels, and more importantly, the required skill mix to service the community, and at the same time improving our cultural scoring through our People Matter survey. Enhancing community trust and engagement is a fundamental tenet for Benalla Health. We have adopted the cultural safety framework. We're very proactive and fortunate to receive valued feedback from our consumers and measure our consumer satisfaction scoring. Our in-home care and making sure that we're providing care where our community wants it to be provided continues to be a focus, but our foundational efforts during the last financial year hold us in good stead going forward. And our contributions to community and mental health sector-wide initiatives has remained a key focus for us. Partnering is viewed as fundamental for an effective health sector. I want to particularly say thank you to our closest health service neighbours, Golden Valley Health, Northeast Health Wangaratta, who we've worked closely with to improve election surgery waitlists and importantly make the journey for our consumers seamless across health services. We welcome the contributions, the mutual contributions to the health service partnership, and also we have an invaluable relationship with our general practice obstetricians. Maintaining financial sustainability has obviously been a challenge through this extended COVID-19 period. We've managed to absorb the pandemic impact with assistance obviously from the department. We've strengthened our balance sheet and we've taken every opportunity to improve our carbon footprint, in particular with our capital expenditure decisions. Benalla Health is fortunate to receive invaluable support from a range of consumers. I'd like to thank the contributions from stakeholders in our health service. The auxiliary, which raises funds to purchase and update our equipment. We have a range of volunteers that work across different areas of our health service. We have consumers that dedicate their valued time to assist with various committees as consumer advocates, and the range of donors that we have. As board chair, I'd like to express my appreciation to the Benalla Health team for their collaboration and hard work to ensure that we have a health service that cares. To the Board of Directors for their challenge, debate and considered and cohesive decision making. Dennis O'Brien for his leadership as former board chair and his ongoing contributions as a board director. To Peter McNeil, our retiring board director, for his 3 years of service on the board, including chair of our finance and audit subcommittee. To Jackie, our CEO, management team, all the staff and the medical workforce for their dedicated commitment and ability to withstand the extreme pressures that have been placed on the health sector during the last financial year. I'd like to now, before I hand over to Jackie, I'd also like to acknowledge the efforts of Andrew Nipsky, our CFO, and the Finance and Audit Board Subcommittee members for their efforts, and thank them for their diligence in navigating Benalla Health's outcomes during another pandemic-impacted financial year. We presented the report of operations in accordance with the Financial Management Act 1994, and the financial statements were authorised for issue on the 21st of September 2022. An unqualified independent audit opinion was provided on 19th of October 2022. In terms of some of the summary results, our operating result was positive, 682,000. That is net of COVID-19 adjustments. It's important to acknowledge that we're very diligent in terms of managing both cash outflows and inflows in terms of the relationships with both creditors and debtors. We improved our current asset ratio as a measure of our liquidity, and also improved the number of days available in cash as well. That is of direct relevance to our financial sustainability strategic priority. At this point, I'd like to ask Jackie to come and share some more insights on our year of review and also organisational highlights. Thank you, Jackie.
Thank you, John. I would also like to acknowledge the traditional owners and custodians of the land in which we meet today, the 8 clans of the Yorta Nation. On behalf of our staff, our residents and our consumers, I'm pleased to welcome you to the 2021-22 Annual General Meeting for Benalla Health. The achievements of Benalla Health during this time would not be possible without the dedicated commitment of all staff, our medical workforce and our esteemed volunteers. 2021-22 was an extremely challenging year. Our staff have endured a considerable amount of pressure working with COVID-19 in PPE and staff shortages. But we came together and worked hard to ensure that we continue to have an organisation that cares. I would like to thank all of our staff for their commitment and the real difference that they have made to Benalla Health and the community throughout the years 2021-22. I would also like to publicly acknowledge the commitment of our board directors. The time that directors devote to their important stewardship role is sincerely appreciated. After 5 years of providing executive leadership to Benalla Health, Janine Holland tendered her resignation as Chief Executive Officer effective from the 4th of July 2021. Janine had worked at Benalla Health since December 2009, initially as Director of Clinical Services and then as CEO. I would like to publicly acknowledge and sincerely thank Janine for her significant contribution she had made during her time as Chief Executive Officer and her commitment to the health service and to the board. I would also like to sincerely thank Andrew Nipsky for taking the role as interim CEO during this time. Andrew provided strong leadership to the health service and board under difficult, ever-changing COVID-19 challenges. And although Andrew has now moved on to a new role, he and his team has ensured we have a sustainable, functional health service that we can be proud of. The board received a statement of priorities from the Department of Health aligned with the department's directions. The outcomes of the statement are highlighted in our 2021-22 annual report, which is available on our website. The Benalla Health Quality Account calendar was also finalised towards the end of 2022, and I would like to thank everyone who contributed to this publication, our staff, our consumers, and our volunteers. The quality account is also available on our website. Partnerships with health services remain strong. We work closely with North East Health on several projects and service developments and remain committed to partnering with our nearest neighbours. Our commitment to the Central Hume Partnership and to the Hume Services Partnership is a priority for Benalla Health to ensure we are giving holistic support to our community. We work closely with all our surrounding health services and support that collective approach to healthcare. A total of 866 eye surgeries were completed in 2021-22, and perioperative services assisted with a total of 2,319 procedures. Benalla Health maintains a high quality maternity services for women and their families in Benalla and surrounding areas. General practice obstetricians work in partnership with maternity services team to provide maternity care to women throughout the birth continuum. Childbirth education classes, domiciliary care, breastfeeding support services are provided by midwives and lactation consultants at Benalla Health. Perinatal, emotional and mental health services are also provided through the broader area mental health services, perinatal and mental health team. There were 85 babies born at Benalla Health in the 2021-22 period. Our at-home service has increased considerably in the last financial year, and we continue to look at ways to support people in their own homes and prevent their admissions to hospital. Our focus is always on prevention and early intervention through our community health teams and their support for the health and wellbeing of our community. Our support of the local Aboriginal community grows from strength to strength through our Reconciliation Action Plan and our commitment to partnering with Aboriginal people to support their best health outcomes. It has been a privilege to walk alongside, to learn and to support. Our urgent care centre treated a total of 5,000 consumers and 9,381 COVID-19 tests were performed by our COVID testing clinic. On November the 30th last year, our staff came together for our annual staff awards night. I congratulate everyone who was nominated, and I would like to thank everyone who nominated a colleague. We received a total of 23 nominations for the 4 awards. I would like to take this time to again recognise our award recipients for their hard work and dedication to Benalla Health. Congratulations to Lainey Wathan, Ashley Knox for receiving an award for excellence in quality service, Belinda Taylor and Kate Shepherd for excellence in leadership, Matthew Charleston for innovation and sustainability, Pauline Montgomery and Stacey Devlin for excellence in consumer care and engagement, and finally Gabrielle Robinson, who received a new award for Best Care Every Person, Every Time. I would also like to acknowledge those staff who received a Year's Service Award. Thank you for your dedication and ongoing service to Benalla Health. As in previous years, Benalla Health received terrific support from the Benalla and District Memorial Hospital Auxiliary, community groups and individuals who generously donated to support our health service. Through this support, we were able to purchase equipment and other important items. These donations are greatly appreciated, and we genuinely thank everyone for their sustained efforts. I would lastly like to publicly recognise and sincerely thank the Department of Health, the Board of Directors, our staff, the medical officers, partner organisations and our volunteers. They have continued to work with us to provide high quality health services to our community that we are privileged to serve. We strive to ensure we give the best care every person, every time to our community. Thank you very much. I'll pass you back to John.
At this time, I can confirm that there are no questions that have been raised during the meeting. And given that is the case, I would like to declare the 68th Benalla Health Annual General Meeting closed. And thank you for your attendance.